Hello, in this video I'm going to talk about neck muscles. Now there are of course many other muscles besides the ones I'm going to cover today, but these are the most relevant to what we're doing in biomechanics. Okay, so starting with the scalenes. A scalene triangle, if you think back to geometry, is a triangle with three unequal sides. So that's where it gets its name. It's a group of muscles, it's three muscles that are of unequal length. So if you can remember that, hopefully it will help you remember that it has three muscles like a triangle, three sides. So its actions, because it's on the side of the neck, are to laterally flex the head and cervical spine. Because they're angled in the anterior direction, it will also rotate the head and cervical spine to the opposite side. Okay, so remember, we're thinking about the origin and insertion getting closer together as the muscle shortens. If it's angled in the anterior direction from back here behind the ear, then when they get closer, it's going to cause the head to turn the opposite direction as this muscle shortens. Also, if we keep the head still and it pulls up, it will help elevate the ribs during inhalation. And then if they work bilaterally, meaning both sides contract at the same time, it will flex the head and cervical spine. Sternocleidomastoid is very similar in its actions to scalenes. So it gets its name, sternocleidomastoid, from its insertions, or from its attachments, I should say. So it originates on the manubrium of the sternum, that's the sterno, and the medial 1/3 of the clavicle, that's the cleido, and then inserts on the mastoid process of the temporal bones, the big bump back here behind your ear. Okay, so sternocleidomastoid. If you turn your head, so let's say I'm trying to feel my right sternocleidomastoid, if I turn my head to the left, the opposite side, and then bend towards my ear, you see it jumps right out and you can grab it. It's this big muscle that pops right out when you do that. So what I just did, I rotated to the opposite side and laterally flexed on the same side. Those are two of its main actions. And that's why I was able to cause it to pop out. So all I did was get my insertion and my origin closer together, which is what happens when the muscle contracts. It shortens and gets those attachments closer together, and there it is. I was able to make it pop right out. So it laterally flexes the head and cervical spine to the same side. It rotates the head and cervical spine to the opposite side. And then if they contract bilaterally, just like with the scalenes, I'll get flexion of the cervical spine and head. And if my head stays the same, or it stays still, it'll lift up and assist in inhalation. Okay, then the last one we're covering here is levator scapula. It's going from the origin is at the transverse processes of the upper cervical spine here, and then it goes down posteriorly to the very top of the scapula. So that superior angle and that superior portion of the medial border of the scapula. So it will, if the head stays still, it will lift up on the scapula, that is elevation. Or because it's pulling from the medial corner, or the medial superior corner, it's lifting up like this, it could cause it to downwardly rotate. So remember, downward rotation is named for the direction that the glenohumeral joint is going. So if we pull up on the medial part, that's going to cause the glenohumeral joint or the glenoid fossa to go in the downward direction. So that's downward rotation. If the scapula stays still and it's pulling on the neck, it will cause lateral flexion of the head and cervical spine. And it also can rotate the head and cervical spine to the same side. Okay, so if the scapula is staying still and it's pulling on this side of the neck, it's going to rotate to the same side as where the muscle is. If they act bilaterally, so both contract at the same time, it will extend the head and neck. Okay, so that is all I have for you in this video. Thanks for watching.